I'm EZRAH reporting on the hottest issues and the biggest stories. This is the Manila Times. The Department of Health aims to create the National Nursing Advisory Council to address all the problems of the nurses in the country. This came after Health Secretary Ted Herbosa continued to push for the hiring of unlicensed nursing graduates as a temporary solution to the country's shortage in healthcare staff. Several lawmakers opposed this idea. Then one of the nursing review centers in the country, Dr. Carl Balita Review Center, even offered to provide free reviews to unlicensed nurses to help them acquire licenses. Now let's hear from the caregivers themselves. Here with us is Filipino Nurses United Secretary General Jocelyn Santos Andamo. Welcome to the Manila Times, ma'am.
For the Filipino Nurses United, what is most important is that the issue of low wages or salaries should be addressed. This is a major and basic issue because this has been a long time problem. In fact, the Filipino nurses receive the lowest salary in Southeast Asia, if not the whole world. And secondly, the problem with our nurse work conditions. Matagal na po yung ating problem with regards to understaffing. That's why our nurses work for more than 8 hours, from 12 hours to 16 hours, sometimes for 36 hours because of the severe understaffing. And this has been experienced for so long by our nurses. Third is our problem with regards to the security of tenure. Many people are not aware that many nurses don't have the security of tenure. We have what we call the job order nurses or contractual nurses serving our people for not only 6 months, they have been contractuals for 2 years, 5 years, or even 10 years, no more than decades. So what we have been communicating with our government that it is very important and very urgent that these issues will be addressed so that the problem of massive migration of nurses will be lessened. If not, of course, totally stopped. It can't be stopped because many nurses really would like to work abroad for better work opportunities. But it is also a fact that not all nurses would like to leave our country because they want to stay on, to work here and be with their families. So we believe that because it is also our right to be receiving living wage, yung nakabubuhay na sahod, these decent jobs, and we can say that they can support themselves and their families. So necessary talaga, as much as possible, ito yung nakikita ng FNU that should be urgently addressed. Urgent na to kasi it has been a long time that the government has been saying that they will study, they will evaluate, and they will see how they can address these issues. Pero matagal na yung pag-aaral na yun, marami ng salita ang nasabi. So what we're expecting and what we're waiting is that the concrete steps so that this can be implemented.
So you were demanding for a 50,000 pesos salary increase monthly. So tell us, ma'am, what is the current situation of our nurses in the country? So what is their current salary po ba, the average?
In the average, in the private sector, in the national average, nurses receive around 10,000 pesos monthly, up to 12,000 pesos. That is in the private sector. In the government, they receive relatively higher, but then they suffer from severe understaffing. So many government nurses also leave. the country to have better work conditions, better work opportunities. So when you ask who benefits from the salary grade 15, those nurses receiving the 36,000 at present is only 10,212 compared to the private sector nurses who numbers more than 100,000. So that's very small, no, compared to those receiving very, very low salary. So
Opo.
majority of nurses are only minimum wage earners, considering that they are professionals who underwent for rigorous training and education and spent more than 500,000, no, for their profession.
Ma'am, is there a shortage with nurses in the country?
For FNU, we don't consider it as a shortage. In fact, the PRC, the Professional Regulation Commission, said that we have the supply. Because based on their statistics, we have more than 500,000. Those registered are a little less of 1 million. So we have around 950,000 na registered nurses under PRC. But those active are just around 51%, according to PRC last March of 2023. So we have a supply, but then our question is, where are these Filipino nurses? According to the data of DOH, last December 2021, we have around 124,000 nurses. They categorized in under the unspecified practice. And we interpret it as those unemployed or not working in non-nursing jobs. So we don't think that there is a shortage. So we have plenty of nurses, but we lack. So that's the nursing paradox, no? There's crisis amid plenty.
We have a lot of nurses in the country, but most of those nurses are working abroad or working other careers outside.
Yeah, they have chosen to have another career because of the problem with the salaries and not receiving benefits, and those working in some government units or even under DOH, they are contractual. In fact, EZRAH, there are thousands of nurses who were terminated this year, under the nurse deployment program of the DOH. It's the equivalent of the doctors to the barrio of DOH. They don't have plantilla positions. Their contracts are renewable 6 months or 1 year. But what is saddening is this year, starting last December, their contracts were not renewed. And supposedly nurses to be employed should be increased, no? But then the HRH, or the nurse deployment program, had a gradual decrease pa, in fact, starting 2019 up to this year.
Ma'am, with the creation of National Nursing Advisory Council, do you think this will resolve your issues with higher wages and security of tenure?
Actually, we're not too excited about it, although, of course, let's give it the benefit of the doubt. If it's an initial step by the DOH, we can say that it can help, but EZRAH, we have been attending meetings and fora initiated by the Department of Health. We have been invited and we have been attending public hearings called by the lower house and the Senate. And it's impossible that the DOH and the government don't know the issues and problems of nurses. But of course, we hope that this can help address our issues. And of course, we hope also that we can be invited to that council.
Ma'am, lastly, do you agree that the government should hire unlicensed nurses who graduated from a nursing degree?
We have been saying that on the first day that Secretary Herbosa said that, we were really bothered and concerned about it because we don't see it as a solution, as an appropriate solution to the problem of massive migration of nurses and the lack of nurses in the bedside or community. And what we're asking the DOH is it really the solution, or we might be creating another problem with regards to people's health and our healthcare system. So we really said that the DOH should think it over and it better prioritize hiring those unemployed registered nurses rather than hiring the unlicensed graduates, nursing graduates.
Thank you so much for that insight, ma'am. So the government should focus on long-term benefits for our healthcare workers instead of a band-aid solution.
What we want is the basic and the core issues should be addressed. And with this inaction or inappropriate steps, we might say that they're just trying to divert the issue, or they are ignoring, they are trying to refute the validity of the nurses' call for higher wages. And we think that it's very obvious. Bakit ba umaalis ang mga nurses sa bansa? Dahil sa kakulangan ng sahod, dahil sobrang baba. And considering na professionals kami, yung in-undergo naming training and education, plus the fact na vital and essential ang nursing functions and profession. Yung role namin sa healthcare, sa nation development is very vital. Actually, from womb to tomb, nandyan ang nurse. At saka 24/7, no? Regardless kung anong panahon, tag-init, tag-ulan, may bagyo o wala, nandyan ang nurses. Although, as an organization, we really encourage our nurses to serve our own country.
Thank you so much, Filipino Nurses United Secretary General, Ms. Jocelyn Santos Andamo. Maraming salamat po.
Thank you, EZRAH.